Hi, everyone. I'm Derek Lewis, and today my guest is, if you'd like to introduce yourself,
My name is Angela Hahn. I'm happy to be here.
good to meet you. So, Angela, what is your career field?
I'm currently working in public health at the Centers for Disease Control and Prevention as a contractor, and I enjoy working in public health. It is the prevention of diseases as well as support of human health on a more systematic, broad population level on a policy, systems, and environmental level compared to medicine, which is the direct treatment of patients and illnesses.
Okay. So, in this case, you're more attacking the social approach to medicine
Yes.
versus the direct approach to just healing the individual that's in the office right now.
Yes. So it's setting up environments where people can have the full potential to become as healthy as possible throughout their lives.
Okay. How did you get into this field? And was it like something like that was your dream, or were you kind of guided towards this?
So in undergrad, I actually at Lehigh University, I majored in public health, and I was able to take a few courses such as global health issues and like community health, and as well as do a few research projects relating to HIV, and that really set me on a course where I was like, I enjoy this, and I want to pursue this within my career, and from there, I got a master in public health. But it started in undergrad and also doing some taking public health coursework as well as doing public health research and then proceeding to get my master's.
Okay, nice. So, what got you into your undergrad, your public health school undergrad?
So I had an interest in being in health in general. I wanted to find a way to help people, and think that think that I was able to kind of feel like I was going to go accomplish that through public health. And yeah, I was Yeah, it was I think I enjoy the field. I think it was, ultimately what I aspired to be. Like, I wanted to do something that felt like I was going to, like, make an impact, essentially. And public health is kind of like a very direct definition of that, like, supporting health on, like, a
Okay.
societal level. So I decided to go with it.
Do you think this is a field for everyone to get into, or is there like a particular type of person that may be
Yeah, so I
best for
think
this?
that's what's so great about public health is it really, I think, can fit a variety of people because it's such a broad field. And it's more of like what's your niche in public health. For instance, within public health, you can go into public health policy, you can go into public health communications, you can be an epidemiologist, you can go into data and informatics, you can go into evaluation and program management and more. And so I think it lends itself for being able you can also go into research and academia. So it really does lend itself for a variety of different people, whether or not you want that policy career or maybe just to be like an epidemiologist. I think it's broad enough for people with different interests to find their own niche. And when you are in public health, there is this element of having to be able to, like, specify, maybe focus more, on finding your own niche, and also giving you opportunity to, like, jump around.
Hmm.
Let's say you were one day wanted to transition into doing something different in public health, you could do that as well. Or it could also even be a focus on a disease. Some people are more interested in infectious disease, some people are more interested in chronic disease or environmental health. It could also just be a topical area where there's different avenues for people to grow a career in or even transition between.
People who enjoy, say, mathematics or
Mhm,
different areas of science,
mhm.
biology, or pretty much anything that has to do with the human health field.
Yeah, so you can be an epidemiologist, I if you're wanting to do something more quantitative or like a biostatistician or data analysis or informatics. Those tend to be the ones that are more quantitative, and a lot of statistical analysis is needed as well. So if you want a more quantitative path, those are the ones that come to mind for sure. So quantitative is perhaps something more. like you mentioned math, so something maybe more mathematical, having to do with hard science. And quantitative might be, well, within data, quantitative has more to do with numbers and being able to categorize data in a mathematical way versus qualitative data might be like something like an interview that you sparse through. That maybe has to do more with words than numbers in terms of the amount of information that you're gathering. Like an example for quantitative data, it's like 53% of people who came into contact with X contracted X disease compared to qualitative is like I went around and interviewed people and here's a common theme that I found. But then
Okay.
also in terms of what field you're trying to get into, some of the ones that maybe are more mathematical might be something like biostats or epidemiology, and something more qualitative might be something more like you were even saying something sociology, policy, um, maybe program management, communications. So there's a lot of different ways. For instance, we need communications to communicate to the public different public health interventions and information and to also change health behavior, communication is important, or policy, including how we can make the world healthier through legislation and passing bills. So it really can go like any direction within public health.
Who or like what kind of people do you think might want to get in this field or should get into this field, aside from those that you just listed, ones who are into qualitative, quantitative, mathematics, sciences, hard sciences?
Yeah, I think if you want to make a change on a broad systems level, public health is for you. In terms of what kind of jobs you might be able to get, a lot of public health is government at the local, state, and federal level. It also is perhaps working at a nonprofit or even a non governmental organization. And those are those are different ways that perhaps if you saw yourself in that kind of career, public health would be for you.
Mhm.
But then I also know people who got a public health degree and work in hospitals or for health insurance companies. So it can really extend in all sorts of directions.
So, in hiring, what kind of people do you think managers are looking for, and what kind of qualities might they need, or what are they wanting?
Yeah, so I think a master in public health would really get your foot in the door for on an educational level for a lot of public health opportunities. And I think this is not specific to public health, but I think being able to speak well to your experiences is really important and being able to match your skill sets to what they're hiring for and being able to fit their job description and what they're looking for and have an understanding of what you're applying to is important. And I think again there's so many different possibilities for different jobs out there, but I think there are core elements of a public health education that you would receive in Master of Public Health, whether that be program management or evaluation or epidemiology, whatever it is. And I think just being able to gain some sort of experience in public health and then being able to speak well to it and also find a position that I think matches your previous qualifications. And there's also jobs for recent graduates that are fellowships, and CDC has a webpage for them, cdc.gov/fellowships, I think. And there's also a lot of fellowships or jobs that are tailored for recent graduates. So public health is interesting because it also has a myriad of opportunities specifically designed for recent graduates with not that much experience, perhaps, who are just coming from their Master of Public Health, where they can then gain these experiences to put on their resume.
Mhm.
And then later, when you apply to jobs, you can, you now have experiences to talk about.
In gaining experience, we're talking about that. Going through getting your MPH or equivalent degrees, what are some of the experiences that you would suggest people go through while they're going through their education before getting to work? Because I know there's certain trainings or opportunities
Mhm.
for like volunteering or
Mhm.
whatnot, interning. What kind of things might someone expect to go through?
Yeah, so common things that people do when they're doing a master in public health is like a research assistantship or a graduate assistantship. And this can be done usually through the university that they're at, and it one can help you finance your way through school and for you to be able to make money or even get deductions in tuition, perhaps depending on which school you're applying to, which school you're enrolled in. And also get to gain experience. A lot of times it's like research done with a professor. For those research assistantships, for graduate assistantships, it could be like a TA position. So, like, you took a class, you aced it, you did really well. And you can then, for the next year of your second year of doing your master's, you can successfully teach it to the next incoming class and impart your knowledge onto them. So there's also teaching assistantships like that, and there are also ways of you perhaps working like an actual job too, part-time or 10 hours a week or whatever it is, and in addition to your studies as well.
And so what about, because I know many people who are in MPH travel abroad for
Mhm.
training as they're getting their education or
Mhm.
maybe like the year before they graduate. Can you speak on that?
Yeah, so actually, some universities have something called like an applied practice experience. Part of that is a requirement to do real world public health as part of your degree in order to fulfill your degree requirements. And so that's a good way of getting hands on training. And you can also perhaps do it internationally too and find opportunities to do it internationally, perhaps find opportunities for your university to fund it internationally.
That's always a good thing.
And that's a great way of gaining hands-on experience, especially if you go internationally. That would be good global health experience if that's also another key topical area in public health if you want to pursue global health as well. And if that's kind of the career that you're wishing to pursue, that would also look good on a resume and be critical experience if you're interested in global health too.
So after going through flight practice experiences, the internships, finishing get or even probably before getting your master's, what are some of the best experience or best advice that you could offer someone who's looking to get into the field? Like some of the things that they're looking to do as far as getting into public health or into the CDC or something that would perhaps go into the global scale of
Mhm.
things or locally.
Mhm. Yeah. So I think so we talked about experiences during school, and then there's experiences that I briefly touched on before called fellowships immediately after school that can help you get your foot into the door.
Mhm.
So, for instance, if you were wanting to work at CDC, they have a myriad of fellowships, which can be found on their website. I think it's cdc.gov/fellowships. There's like an ASPPH one, which is the Association of Schools of Public Health. There's a PHI Public Health Institute one with Global Health Fellowships. I did an ORISE fellowship, and that one also is rolling admission and is through every center, institute, and office in CDC. So you could really go through an umbrella of different topical areas. And then a presidential management fellowship, which is one of the more prestigious fellowships. And also there's one LSS fellowships, there's laboratory fellowships for those who have a background in laboratory science, and so there are also things that you wouldn't think maybe directly are public health that actually are public health, such as laboratory science. So
Mm.
some people might just even have a degree purely in in a like, let's say, a biological or what a science as well. So that's another avenue where you can end up in public health as well as through laboratory experience. Those are some fellowships that the CDC offers. There are also different opportunities beyond CDC that you could also go through for different fellowships to have to like get your foot into the door. So I would that's a good way to get your foot into the door for any organization is check if they have any fellowships or internships and then network and make connections, and that'll help you for sure get your foot into the door. And I know the federal government is a little hard to get into. It kind of sometimes feels like an exclusive club almost. It really does require, I think, something like a fellowship or and like connections in order to be able to pass something called the cert, which is like a certification of lists of names. So there's almost more specific ways, or even AmeriCorps. If you do AmeriCorps, that could be a way of getting your foot into the door. So there are more almost specific paths for you to be able to get your foot into the door when it comes to federal government, because otherwise, I think it does feel a little bit of like an exclusive a club, and when people enter, they don't leave, historically, at least.
And generally,
It's
yeah.
been different this year.
Can you speak more on the O'Reilly Fellowship that you went through, and also about the networking? Because a lot of people on the outside are trying to figure out probably where to network or how to network, possibly as they're
Mhm.
going through school.
Yeah, so I think fellowships are a great way to get your foot in the door and make relationships, because I think just applying cold for a what they're called FTEs, or it's
Full time
a
employees.
full-time employees to get a permanent position as an employee in the federal government can be challenging, especially if you just apply externally. It's almost a lot easier to get, not almost, it is a lot easier to get a federal government job with federal government experience. So a lot of jobs are internal, which
Mhm.
really means they are recycling their
Hire from
employees.
within, yeah.
They're recycling their existing employees, essentially. So I think fellowships are a good way to get your foot into the door to get that federal government experience that people want, because at CDC we call it institutional knowledge. A lot of times in federal government they're looking for institutional knowledge, which is how does this organization even run? Which actually as a student I was not aware of how much just knowing about an organization played into, and knowing how to operate within an organization played into your value as an employee, just understanding how this organization works. So I was interested in health equity because of that principle of everyone deserves the chance to receive the highest possible health possible, regardless of their background. And I was also interested in DEI, and so I got a health equity ORI's position with the Office of Laboratory Science and Safety, and it was pretty much working for DEI for a office of 80 people at the time. It's since gone under a reorganization and turned into something different and larger. And I enjoy that position a lot. I found it really meaningful. It had the unique spin of trying to apply health equity in the context of laboratory science, which nobody knew how to do that or what that was. So,
What was it then?
and so it was my job to figure that out.
Oh,
And and so I had to do focus groups with laboratory scientists and ask questions and try to come up with a clear definition for what health equity meant for the Office of Laboratory Science and Safety and for CDC laboratories. And it's a bit of an opaque process for laboratory scientists to understand really how that health equity would apply to laboratory work, because I think it's probably less opaque if, let's say, you were working with HIV AIDS on like a programmatic level and you were trying to address some of the disparities there. But for like laboratory scientists who are just like pipetting, it's a little bit more, what does this mean in the terms of my daily work? And so that was my job. I I don't think, I mean, I didn't, completely ever came to a concrete resolution with that. I did develop a bunch of materials and guidance. By the time I had left as an FT, it was not completely consolidated as a clear standpoint on where OSS was with that. And also, it's since been almost entirely removed, actually.
oof.
So it not only, yeah, and then 2025, DEI was essentially, we were just told we could not do that entirely, and those jobs were scrapped. So it also no longer had a possibility of even moving forward, even in terms of what we were allowed to hire for and what we were allowed to emphasize. So it was also, I was the chair of the Health Equity, Diversity, and Inclusion Committee, and it, no longer exists.
If someone's looking to get into the CDC or any other public health situation or area,
Mhm.
what are some of the ways that one could network to get into those?
Yeah, I think a fellowship is a great place to build relationships with people at work. I think even just cold finding someone on LinkedIn who has your dream job or some a place that you would like to have your foot in the door and just being like, can we have an informational interview? I'm interested in learning more about the field. Works great. So just even cold reaching out to people
Are a
and
lot of people really
LinkedIn.
receptive to that?
Yeah.
Oh, okay, nice.
Yeah, I still keep in touch with Naomi, and that's there's someone I've have cold messaged people with I just saw CDC, and then I cold messaged them. Maybe try to find people at CDC who graduated from your university. I think that's what worked for me.
Oh,
So you
okay.
guys went to the same university, perhaps. And if you're a prospective student, I think people are maybe more open to hearing you and to giving you guidance. And then any professional workshops or opportunities or you that you can attend to as well. I think a lot of universities will like send out different events that networking events that you can join and such.
Mhm.
So it's possible to do that as well.
What are some of the other places people can find positions within public health?
You can just go on different companies' web pages too, and or Emory actually has a really good job board for public health as well. Nonprofits come to mind. The different like organizations that come to mind for me are like the Global Fund for and uh, the World Health Organization, USAID, which also is not
It's
it's
taking a
not
little bit of a hit, yeah.
it's taking a bit of a hit. CDC, there's different public health jobs at different universities, so you can look at universities, university public health organizations, not different nonprofits. There's the Bill and Melinda Gates Foundation, the Clinton Initiative. There's a myriad of different public health organizations out there. State and local public health departments. So let's say you live in a state, like
Right.
your health department for that state or your local city health department for your city, which is probably you're going to be closer to your community there than the federal level too. So there's the local level, the state level, and then the federal level.
Because small communities and or state communities need that sort of help too as well. Because it's not just an entire nationwide or completely global field. It can be just done in a city.
Yeah,
Yeah.
yeah, and they'll be closer. I think sometimes it's a little harder to feel the change that you're making on the federal level. So you would be maybe feel closer to a community at the community level and perhaps see the change that you're making within a community a little bit more than at the federal level. I think you get a little bit more removed from communities at the federal level than literally being at the community level.
Okay. So, at the start of a career in public health, what do you think someone should be prepared to focus on or to have thrown at them, maybe?
Mhm. So I think having good experiences is good to I think there is an aspect of needing to narrow it down, right? Like I said, like are you interested in policy? Are you interested in epidemiology and evaluation? There's this aspect of having to narrow it down or even focus on a disease. Or is there a specific disease that you're interested in? Chronic infectious disease, are you interested in global health? And you can specify through your studies as well as your experiences. So I think first picking which what exactly do you want to do within what's quite a broad field.
Mhm. What about when they first start working? What could
Mhm.
they perhaps expect to have? Like, what would their work experience be like?
Mhm. Let's say you got a communications job that could really look like creating communications materials. For instance, let's say you were interested in HIV and you could develop communication materials on PrEP usage and PrEP adherence, or let's say different communications to ensure that the population is healthy and adopting perhaps certain behaviors. Let's say you're interested in nutrition, it would be perhaps about healthy eating and what you should eat in a day and like staying away from fast food and
Right.
here are some healthy cooking activities for communications. Let's say it was program evaluation. Might be collecting data, whether it's quantitative or qualitative, and evaluating how successful this program is and its public health initiatives based off of the evaluation of data. So it's evaluating the effectiveness of a program that you're working on.
Right.
So that it could look like that. If it was policy, it could look like working to build network with legislators and drafting different policy analysis documents or issue briefs or different policy proposals or trying to get certain bills passed. It could also look like that. So it really just depends what your yeah, it's quite broad and really depends. I think that that is something is when you interested in public health, there's two things. There's like the topical area? Do you like nutrition? Do you wanna work with HIV, with TB, with malaria, or chronic disease like heart disease, cancer? And then there's also like, well, how do you wanna do it? Do you wanna evaluate different programs? Do you want to do data analysis? Do you wanna do policy? Do you wanna do comms? That list goes on. So it's quite broad.
Another question is, and I meant to ask this earlier, what kind of skills do you think? I mean, granted, there's also another
Mhm,
broad question. So, like, so if someone wants to get into any of these things, epidemiology or
mhm,
any of the other under the subcategories of public health, what kind of skills should one probably focus on or expect to build as they're learning?
mhm. So, I think you would probably get maybe more of those fundamentals within the master public health education. I think for epidemiology, it's probably working a lot with different software, or whether it's SAS or some other sort of statistical analysis software where you're kind of like a disease detective and maybe looking at incidence and prevalence of different diseases and how they might be transmitted throughout the population
Mhm.
and how and like what are perhaps some future trends with the disease too, maybe some predictive analysis of where in like 10 years what the incidence on the population level would be. So it could be something like doing something more data analysis in terms of being a disease detective and understanding patterns of how diseases kind of spread throughout a population or what their incidences.
What kind of tools do you use in the field? I mean, aside from like computer.
Yeah. So my job is also very specific. So there's CDC actually most of its money goes out the door to local and state health departments. We call them our recipients. It's often done through what's called a cooperative agreement, which is the federal government's version of the grant that they emit. And so I currently work at CDC has different centers, institutes, and offices, and a lot of them are based off of topical area within CDC, whether let's say EZID is the emerging zoonotic and infectious diseases. The one that I worked on previously was about laboratory systems and response. And the one that I currently am working on is the Public Health Infrastructure Center. I think it's the National Center for State, Tribal, Local, Territorial Public Health Infrastructure Center. It's called STILT. We have a lot of acronyms, STILT and FIC. And so I work to essentially do financial monitoring for a cooperative agreement, monitoring the money that goes to recipients on state and local health departments to fund their work. So I'm essentially doing financial monitoring for money that's allotted to do public health work. And I work on Salesforce to do this, which is a customer relationship management platform. So we give them things such as they have work like our recipients, they have work plans, milestones, success stories. So different ways to track how their money is being utilized and to make sure that they're meeting their program objectives and goals, as well as to track all the financial expenditures and data.
Okay.
So there's a lot of work with Excel and there's a lot of work with Salesforce and maintaining the data within Salesforce to make sure that there is data validity in it. And I also make dashboards using Salesforce CRMA and Power BI to ensure that to provide our recipients with data that they can understand to track their performance measures as well as the expenditure of their data. What how much money is allocated, how much money has been utilized, and for which purposes as well, the distribution and allocation of it. So, just a lot of financial data is the job that I currently do, and it's really to support somebody else's public health work, but
Makes
that's what
sense.
it that's what it is. Yep, so again, more stuff there's so we really oversee the public health infrastructure grant, which oversees billions of dollars. See the national NPC, which is the National Partners Cooperative Agreement, and oversee the health block grant. So there's I work on the public health infrastructure virtual engagement team, which is where I'm a contractor right now. So it really is tech support for Salesforce, for the FTEs. In terms of I work with it on a team of with the Salesforce developers too. So it's really tech support for Salesforce. And those are like I would say our three main buckets: the health block grant, the public health infrastructure grant, and the National Partners Cooperative Agreement. And our and the public health and it's a billions of dollars annually. So it's a lot of money that we're just making sure is appropriated correctly.
Going to the right places, yes. Because we're talking about systems and places and people getting into the
Mhm.
public health area arena. Can you speak more on like the structure of the work environment, like where people are going to be focused on what and how things kind of roll?
Okay, so CDC is very big on this. We have org charts. So it So I would say things are for new people looking to go into public health, you could perhaps look up what CDC centers, institutes, and offices are and see which one really piques your interest. And you can go from there. So, for instance, NCHHSTP is the National Center for HIV, Hepatitis, Sexually Transmitted H- tuberculosis, and sexually transmitted diseases. So, if you have an interest, you could be like, I really want to work for NCHHSTP. Or EZID is the Emerging Zoonotic and Infectious Diseases. We have a chronic center for chronic diseases. We have a global health center. So you could perhaps look at CDC CIOs and be like, this is my dream place that I want to work at. And I would say we're pretty divided by CIOs. So it's almost like they're different departments. Sometimes it feels a little bit like we're siloed by CIOs, but it's like they're almost like different. Well, they're not almost, they're literally different centers, institutes, offices, like divisions. So that's one way there's already organizational structure, right? And then within each CIO, we have our org chart. We have our leader, right? We have the CIO leader, and then we have different branches too. And then we have different like leaders within branches. Then maybe we have like a policy team and like a policy lead or like a comms lead. And so you could look at a different organizational chart within a center or institute or office to get an idea of how that organization is structured. So it's kind of like a tree almost, an org chart, right? There's like a team and then there's different groups and then there's a lead of each different group. I think outside of CDC, I'm trying to think how this would be structured. Really, what really comes to mind is just that like federal, state, local level.
Right.
So there's different ways of the local level is the closest you get to a community. The federal level is like the furthest you get to a community.
How does it feel to work in a place like this, like in any public health section? Because you've been in
Mhm.
the CDC building, you've been in the contracting arena. So
Mhm,
how does it feel to actually work? Like what kind of things can you expect of treatment of
mhm.
employees and such?
I really loved working I really love CDC people. I think the atmosphere is really chill. It's, like, not cutthroat at all. It's pretty laid back, and everyone is kind and nice. Previously, there was a lot of longevity in federal government, so it does have this air a feel of people looking to come in as a fellow and establish themselves and perhaps be here for 30, 35 years and to have kind of this extended kind of great federal career. Currently, that has been shifted, but previously there's definitely a culture of longevity and wanting to stay here for an extended period of time. And for it to be both possible as well as a lot of your coworkers and your own perhaps your own plan. And there's different GS levels. So there's like almost this idea of like being promoted and growing your career by ascending essentially the grade scale, which is kind of how federal government employees are paid, but it also relates to your position and perhaps the amount of responsibility as well as authority you have in a position.
Right. GS level is
A grade scale,
grade scale. Okay.
yeah. But yeah, so it's a pay scale, but it's also, I think, an idea of how people would like to climb up it as they progress throughout a career and assume more responsibility and perhaps was definitely was definitely possible as well as expected or like it was common that people would want to stay here for a very long time and and not perhaps not be like, oh, I'm here for a year and then I'm gone, I think that was not the culture.
Right.
And so I think yeah, it's laid back. There's longevity. I think people are kind and nice. Yeah, it's pretty, I would say federal government employees are pretty chill. I don't think it's very cutthroat. It's not like a cutthroat environment that maybe some environments are cutthroat. It's a kind of quite the opposite. And everyone is here doing public health, right? So the idea is service to the people, service to the American people, wanting to make a difference, wanting to implement change at a community on a community level. So there's this kind of altruism within the work and within the work culture too.
Mm, that's good. Where do you see the field progressing, public health, in the near future or distant future? Do you see it changing? How do you see it changing?
I think a third of CDC has now been laid off or in some capacity reduced. I think certain topical areas took the biggest hit in terms of global health, in terms of things like health equity and DEIA. So I think for perhaps the remainder of 4 years, I there is a decrease in the number of opportunities, and I think that is also really intrinsic to public health since public health is government. A lot of public health work is government, and if we're gonna slash the government funds, right, that's just gonna lead to less jobs. So I think there I think perhaps for graduating students, think places that might be safer perhaps might be something like working at a hospital, working at health insurance companies, working at a private company. I think perhaps those are maybe not receive the intensity of scrutiny that the federal government is currently getting and
Right,
perhaps the
right.
instability. So nothing terribly positive for the remainder of these 4 years, but then hopefully, I think there will be a lot of opportunity for rebuilding and a resurgence of interest and investment into public health and also the creation of jobs and opportunities um, um, post after these 4 years, after perhaps in the future. Yeah.
All right. So currently, it seems like, or sounds like, it's going to. be a good idea to lean towards the civilian side of the house rather than going government and then wait to see things kind of calm down and then perhaps think
Yeah,
about transitioning
yeah,
from that so you can gain your experience while you're in the
yeah,
civilian side of the house and then maybe move to the federal
yeah.
or
Yeah, I would recommend that. I would say I mean, we're quite literally in a hiring freeze right now, so there's and we don't know how long that's gonna last.
right.
So you literally cannot get a job in the federal government right now. You could perhaps get a job as a contractor, which is what I did after I was let go as a probationary employee. And you could perhaps also get positions at the local and state government health level. I do highly recommend you going working for something like a hospital or health insurance company or private, and I think that would be great experience to get, and then perhaps later transition into, the federal perhaps the federal government once things are more stable. I think that would be great for students who are interested right now.
Okay, good. Well, Angel Hahn, thank you so much for your time. It's been
Okay,
good.
thank you. It was an honor. It was a huge honor.
Well, that wraps up our interview. Do you have any lasting words or last thoughts that you think of for someone perhaps going into this field that maybe I missed?
Just thank you for your interest and your hard work. It does make a difference. I think public health has a great group of people with just from the nature of the work. I think it brings great personalities and people. So I'm excited for all of your futures.
Well, thank you, Angela.
Okay.
Goodbye and good night.